Welcome back to The Pulse. This month, Ghana will roll out a new vaccine mandate policy targeting some groups. That is part of government's broad strategy to help achieve herd immunity and limit the impact of the Covid-19 infection among population. Ahead of this, the Ghana Health Service announced a month-long mass vaccination campaign, after which the vaccine mandate will kick in.
These are the proposed mandates which we are going to pursue. With the increasing availability of vaccines and reasonable quantity in the pipeline, we are declaring December as the month for vaccination, or let's say vaccination for Christmas. So December is going to be declared as the month of vaccination, and it will be launched by the Honorable Minister on 30th of November 2021. That's Tuesday coming. This mandate, which I'm going to announce, will be applicable in January 2020 as specific groups and manners as soon as, and this mandate become effective as soon as the campaign is over. We have them in two sections. They are going to have proposed groups that will be covered under the mandate and the venues. We are looking at all the three arms of government. All health workers have been given the opportunity to vaccinate, and they stay in a very strategic position that either they can share among themselves or give to their patients.
And that was Patrick Kumabwaji, who is Director General of Ghana Health Service, announcing this a month ago. But after the month-long mass vaccination program, the country has only been able to vaccinate 2.8 million people, more than 17 million short of the target announced by President Akufo-Addo. There are some 6.6 million people, though, who have taken a single dose of the jab. The question is, will Ghana be able to roll out the vaccine mandate this month? What will it take for Ghana to reach the 20 million full vaccinations? Will there be the need for booster jabs in between? That's the crux of our conversation today on The Pulse. Now, I'll introduce my guest to you shortly. First, let's take a look at the data on our vaccinations so far, and total doses administered, it's 8,872,253, and as at 3rd January 2022. And you know, this is made of Johnson & Johnson, AstraZeneca. So, and then you look at total doses administered, and that's a breakdown. At least one dose, 6,598,879 people have taken at least one dose. And if you're looking at people who have been fully vaccinated, you're talking about 2,833,673. So you will see that the people who have taken just one dose are more than those who have taken the full vaccination. And these are the type of vaccines available in Ghana: AstraZeneca, Sputnik V, Moderna, Pfizer, and COVID. So now we'll look at AstraZeneca. 6 million people, 46,958. They have taken the AstraZeneca vaccines. People who have taken Sputnik V are 17,982. Moderna vaccines, you have 941,070 people taking. And then those who have taken the Pfizer vaccines are 1,305,944. You put all COVID-19 vaccines, and you have 8,872,253. That's a total of people who have taken the vaccines. Yesterday, some public entities started demanding proof of vaccination before allowing people entry into their buildings. The Health Ministry is one of them. Manuel Kranting was on that beat for us. And now we'll bring you that file just a while in the bulletin. But let me speak with Dr. John Amoisi, who is a public health expert and also lecturer with KNUST. I've also been joined by Dr. Peter Kwashi, who is with WACBIP at the University of Ghana. I'm grateful for your time, gentlemen.
Thank you, Aisha.
Thank you very much.
Let me start with you, Dr. John Amoisi. Definitely, our vaccine mandatory, the mandatory vaccination ended just in December, end of December. How much progress have we made? But before we even talk about that, let's look at the surging in numbers. If you talk about COVID cases, what could be accounting for those increasing numbers that we've seen recently?
Well, thanks for that, Aisha. Good afternoon to everyone, to Peter, who's also on the show, and to everyone listening. I think it's really important we're having this discussion at this time, because we should be in a position to anticipate a potentially worsening situation by the middle of next week. I think it's not rocket science. This was very clearly predicted, including by the Ghana Health Service, who gave copious warnings regarding the Christmas and New Year festivities. I think given the trajectory which we saw, it was just really very unfortunate for us that the acceleration in the transmission of the disease has occurred exactly in tandem with the Christmas and New Year. I would say a place like South Africa, where this new variant Omicron was discovered, was damn lucky, for lack of a better expression, to have had their surge before the Christmas. And so really during the Christmas and New Year festivities, that's when they had just passed their peak. And so they were very lucky in that respect. Unfortunately, our acceleration sort of coincided with a period of intense socializing and physical contact during the holidays. And so this is sort of a lethal cocktail which allows for increased spread of the disease. It's very clear that the Omicron variant leads to much milder disease and less risk of hospitalization and death. But where you have a population where vaccination is not very high, ultimately, when the number of cases rises beyond a certain threshold, you begin to see significance in the numbers of hospitalized people and the number of people who are dying. I can tell you the infection rates are astronomically high, even compared to last year about this time when we were having another wave. The saving grace is, again, this less virulent Omicron strain. And if we had the same kind of strain as we had last year, by this time it would have been a total disaster. That notwithstanding, given that we're going to be seeing more cases from this weekend into next week, it is easy to predict that the number of hospitalizations will go up a little bit, and unfortunately, most likely also the number of deaths. And then when that happens, it becomes of great concern, which is why the vaccination becomes critical, because what the vaccination does is it is that wedge that you put in between the transition from getting infected to being severely hospitalized, and automatically also impacts on the number of deaths that we have. I think it was very smart for the Ghana Health Service to institute December as the month of vaccination. I think they tried. Unfortunately, the uptake was not as extensive as would have been desired by any measure. And so at this stage, what all we can do is to continue with this vaccination drive. You spoke about the boosters. What I can say from the grapevine, I understand that boosters can be accessed by people, and I say this with caution because I only made some very crude inquiries, and I got the understanding that, look, if you want an extra shot, you could get one, but I have not heard any official communication on anyone who's already been double jabbed with anything who wants another jab can go and get one. I repeat, I have not received any official communication to this effect, but my understanding is that if one really wants one, they will not be denied one if they go to a facility. But I would really encourage you to confirm this with the Ghana Health Service officials, as they really are the ones who can speak to this. That notwithstanding, I would strongly encourage the Ghana Health Service to officially communicate, if possible, the opportunity for two things. One, the boosters for those who have had the vaccine and want to have a boost, in order to avoid wastage and expiry of some vaccines like we had last year, because some parts of the country just would not take the vaccine. And then the second thing is the vaccine for people who are younger. We've heard the recent change in direction from the US CDC, now allowing the Pfizer vaccine to be taken by people as young as 12 years old. I think that's a great development, and we could also institute this as quickly as we can. Ultimately, the key is getting as many people vaccinated as quickly as possible, which would limit the spread of the disease. Another worrying thing is this other new variants which are emerging. We've heard of this potential new variant from France, which interestingly seems to have originated from Cameroon. But these are, again, things that we spoke about, that Africa, with its low vaccination rates, will be the melting pot for the emergence of variants. I could bet my bottom dollar that we only saw Omicron from South Africa because of how active South Africa is in surveillance. They're actively surveillant. They are sequencing on a regular basis so they could pick this up early. But it wouldn't surprise me if there may be several other variants emerging from other parts of Africa, which could have many more mutations than Omicron, which again speaks to the need for vaccination. So let me just repeat again, with what we've seen currently, there's some anticipated uptick in number of hospitalizations and, unfortunately, possibly number of deaths, and we've already seen them inching up very slowly. And my hope is that it will not go beyond a threshold which would be catastrophic for us. But by and large, for now, the vaccination, pushing it as hard as we can, is just the way in which we should go.
Dr. Kwashi, what has your research shown, I mean, with regards to the variant that is dominant in the infections we're seeing recently?
So in terms of the surge that we're seeing right now, the recent sequences, which the data that we have, which we have shared with Ghana Health Service, shows that around about 74% of samples from Greater Accra that we looked at had, actually 79% had the Omicron variant, and there's still about 21% which are Delta. So there's still a bit of circulating Delta around. So those are the two main variants that we're detecting currently.
And looking at, we were told that the Omicron variant usually doesn't it gives mild symptoms, but right now we are seeing people dying. We're seeing a lot more people being hospitalized. What could be the problem here? Well,
I think the experience so far is that it does seem to give more mild disease in Ghana. The reason why we're seeing an uptick in deaths is just based on numbers. If you look at the sheer numbers of confirmed cases, we have never ever since COVID-19 started had this number of active cases that have been confirmed in the country. So when you look at it in that lens, then you realize that the seeming increase in deaths is not really because of the severity of the disease, but rather the extent of spread of it, you know. So that's where, as Dr. Amoesi said, it's really critical that we try to get as many people vaccinated as possible, and we try to still, I mean, this is sort of beating the dead horse, but try to still get some semblance of respect for the COVID-19 protocols. You know, but right now, early on last year, when the government said that they would have 20 million doses in country, some of us were doubtful, and they managed to do that. And they have tried to get those doses administered. And what we're seeing is that, unfortunately, there's been a lot of misinformation, a lot of misdirection, and the initial speed at which people were clamoring to take up the vaccine has slowed down, and I think this is what has forced the government to go the way of mandates, as have other countries all around the world. Because once misinformation and political misdirection comes into the fray, then you have to start to look at doing these sort of addresses for the public good.
Dr. Moisi, what can you say with regards to our vaccination drive? I mean, what's your assessment so far?
Well, I think as Peter put it, the anticipation was for a lot more people to have been vaccinated by now. I think these were the government's projections based on the vaccines coming into the country and also the month of vaccination that was declared. It's unfortunate that the uptake in the vaccines was just rather poor. Unfortunately, the vaccines have come in. There are several millions of doses available, but the sense of urgency to take the vaccine is so low. An additional spanner in the works, which is where I think we need to do a better job of our communication, is with the Omicron. And the sheer number of people who are vaccinated who have gotten ill with confirmed COVID, and which is just making it look like, okay, look, whether you're vaccinated or not, you're going to get the COVID. So what's the point? But the whole narrative right now for the vaccination used to be, take the vaccine, you're unlikely to get the COVID. But now it is take the vaccine, you are less likely to get the COVID, but if you do get it, you are less likely to get severely ill and almost unlikely to die. But this change in communication strategy based on the new variant and the new knowledge that we have, just so our communication did not move at the same pace as the virus. And this is what has led to the poor uptake of the vaccination. And so it's like it's kind of a moving target. And so the target is there. You focus you train your gun on it. You're about to fire, and the target moves, and you say, "I'm going to keep my gun trained at the same spot." But this doesn't work. So it's a moving target, and we've got to move the shooting in the direction in which the target is going. And that's the way we need to modify things. If we don't do this, we will keep playing catch up, and we will not get the best out of all the efforts that we are making.
So it's obvious that we're going to be seeing more of the cases, especially after we've had our festive seasons. Definitely, we're going to be seeing more. What should we look out for, Dr. Moisi?
Well, as I already mentioned, I mean, sad to say, but again, it's just not rocket science, and we cannot be wishful or otherwise here. With the current trend of things, there will be an increase in number of cases and ultimately hospitalizations by the middle of next week, this weekend going into next week. I think Peter really put it beautifully when he explained that it's just a sheer number of cases that we're seeing. The positivity rate has never at any time been so high. If this was Delta, it would be a sad situation by now, totally sad situation. We are so fortunate that it's not Delta, it's Omicron. And so the number of severe cases or hospitalized cases and death relative to the infection rate or positivity rate is low. But given that the positivity rate will be going up or is going up, it will translate into some uptick in the hospitalization rate and in the death rate. And this is really important to understand and to anticipate. Even if you start vaccinating now, it's not going to change that situation for next week. But we can change what will happen, next 3 weeks, next 4 weeks by getting our vaccination game on. The vaccines are available, the vaccinators are available, the centers and sites are there. It's just moving those vaccines from the fridge into arms. That's where the problem is. And a lot of it is all a communication thing. I think the media and every other possible outlet should really train all guns on vaccination. If everybody's, just shouting vaccination and this is really all over the place, it will make a big difference. And I think this is the only way. A lot of people from towns and villages all over the country were in the major cities. People move from the cities also towns and villages. This is why I'm concerned about this weekend and next week and what impact that's going to have on the positivity rate and ultimately severe cases and deaths. So I think active communication strategy, bearing in mind that this is a moving target, would be the way to go.
Dr. Kwashi, the first, second, third waves at least taught us a lesson. There were a number of things that we did that worked out for us in a way. Some of them, not to stay in an enclosed area, normally stay outside where there's a lot of ventilation. Don't stay in cold areas, stay where you have a lot, some temperature, because the virus does not like much heat and what have you. Does this new one require a new approach?
Not necessarily a new approach, as in it's because it's more infectious. For instance, if you follow American pro sports, you know that some of the places where they have very strict protocols, they've now reduced, let's say, an arena which would have a capacity of 50,000 now only has a capacity of 1,000. So basically, the main measures would be, which I think the government is trying to go in that line, is really restricting or completely abolishing things like functions indoor, because just to reduce that infectiousness of it. Because whereas in the past we used to say 2 meters, there's now published work showing that people who are separated by much more than 6 meters and things like that, of course, this is all preliminary, were able to be infected by this variant. So that's the key thing that we have to remember, that this is much more infectious than than the previous variants. And this is something that when you understand the biology of viruses and transmission, and it makes sense, because the more you try to control for something, the ones that tend to escape and be more fit tend to have those kind of characteristics. But one thing that I wanted to mention, we've been talking about vaccination, and I myself have said it as a public health good. But beyond that, it's actually a personal good, meaning that if you look at Omicron, and I had made this point earlier, a lot of the people who have tested positive with Omicron based on contact with travelers have had a bit of, have had at least one vaccination or 2 vaccinations. And this is also in the cases that they saw in South Africa. We don't really know what it will do when it gets into the masses of people who are not exposed to vaccines at all. There's not a lot of literature on that. So we can't just look at it and say that, oh, it's mostly mild, because we don't know that. It's mostly mild in vaccinated people. It's mostly mild in people who have either had prior COVID or been vaccinated with at least 1 dose. There's not that literature showing that it's mild in unvaccinated people, at least not that I'm aware of. And so far, the experience has been that if you are vaccinated, as Dr. Mwesi pointed out, your chance of getting severe disease or even getting symptoms is vastly reduced. And that's the point of the vaccination. It's not to prevent infection, because for your immune system to work, the virus actually has to come in for the system to see it. And your vaccine will now start to work. The immune memory will now start to work, and then you are going to have much less reduced symptoms or no symptoms at all. Right.
Dr. Mwesi, so I'd like to pose the same question to you. Do we require to do things differently, especially as we've seen that the Omicron is more transmissible than the other variants that we've seen in the first, second, third waves? Should we do things differently?
I think that's a good question. There's nothing to do particularly differently, except to place emphasis on 2 areas. One is the vaccination, and I'll just a little caveat there I'll make mention of. And then the second thing is just these prevention protocols, as Peter already mentioned. I like an expression he used earlier in his submission when he said, trying to pursue some semblance of adherence to the protocols. I mean, that just shows the level of frustration and also just you just know that it's really hard for people to, over a prolonged period of time, keep on wearing that nose mask, keep on adhering to the distancing. At a point, it's just like, you can't live your life like this all the time. But the truth is that it actually does work. The mask wearing and the distancing, it just works almost like magic. We see people who are in the mask, we know they were exposed to people who were infected and they don't get ill. And those who are not wearing the mask got ill. And I know because we have people coming to us all the time, and we know who was with who and that kind of thing, and we can see who got infected and who didn't. So these things work, and we need to sort of really reemphasize this, particularly where there are mass gatherings, really reducing the numbers of people. And I'm expecting places like churches, places of worship, mosques, and others to really, really do their best to press home this mask wearing. I think these are some of the best places where we can show leadership and example by adhering to these. The use of the hand sanitizers in these places of mass gathering can make a huge difference. To the vaccination, I already made mention of this, but there's an important caveat that we need to start really discussing right now, which is, as the variants emerge, the efficacy of the vaccine in preventing infection will be lowered. What this means is that something beyond Omicron may come up for which being vaccinated may not be as effective in preventing you from getting the virus, even though it might be effective in preventing you from getting seriously ill and dying. And our ability to communicate the role of vaccination and how this might actually change what your chances of either getting the disease, getting seriously ill, or dying is so important. You don't want a case where you push or drive home a message so hard and in so inflexible terms that when the information changes, you can no longer go and say, hey, folks, it's changed. Now it's this. We need to start introducing these caveats, because new vaccines are being produced, which are more targeted towards Omicron. What we have are vaccines that are targeted towards the alpha and beta, essentially, not even to the delta. So we've got to understand that it's a moving target, and we need to devise a very slick communication mechanism that can take care of these nuances which will be coming up as the virus evolves.
I'm happy you talked about the vaccination drive and the successes we've talked so far. I want to find out from you, with the numbers that we've seen and how the vaccination has gone, is it likely that we can go ahead with our mandatory vaccination as the Ghana Health Service intends to, the exercise it intends to embark on?
No, absolutely. I mean, I've always maintained 101% behind these vaccination mandates. I actually predicted them, and I'm glad that it happened just as predicted. That is the way to go from a public health perspective. The risk associated with vaccination is so negligible, it makes complete sense to have these vaccine mandates in public places. I'm looking forward to the extension of these vaccine mandates to places of worship and other places where people gather en masse. There will be resistance to it, but it's one piece of legislation or action which the government can take, and the government being responsible for the public's health. This is really where they come in, take these bold decisions which will protect the public who they are responsible for. So absolutely, the vaccine mandates are the way to go. If the mask wearing mandates were so difficult to push, the vaccine mandates perhaps are a lot easier to enforce, because there's this evidence of it. And I would be in full support of this. Absolutely, that's just the way to go.
Definitely, the vaccination, the figures, it's nowhere close to our target of 20 million. Dr. Kwashi, is the hope of building herd immunity eluding us?
That's an interesting question. I would say no, not really. I mean, the hope of building herd immunity through vaccination seems to be eluding us thus far, but also almost as a byproduct of that, and as a byproduct of our ineffective enforcement of COVID-19 protocols. We know that what we measure in terms of confirmed cases are mostly just the symptomatic cases that go to testing facilities and people who travel. What our work shows is that there is a lot of undetected transmissions happening in the community. And before Christmas, we shared data that showed that in Greater Accra, for instance, about 54% of people have been exposed to some form of 19 between the second, the third waves. So I believe eventually we'll get there. Of course, vaccination is the safer route to get to herd immunity. You don't want to go to herd immunity through infections. And I had put a Twitter post some months back that the road to herd immunity through infections is paved with dead bodies. And we've seen that in a lot of countries around the world. So I don't think herd immunity or herd exposure, I prefer the term herd exposure, will elude us. But we want it to be through the safest possible methods, which is vaccination.
Dr. Moisi, do we have a second chance of meeting our target of 20 million, or we've completely missed it?
No, I wouldn't say we've completely missed it. I mean, the vaccines are in the country. The vaccines are up for purchase or for request when you need them. So it's all about this transition. You know, it's multiple steps. First of all, the vaccines have to be available. Then they have to be affordable. And those two hurdles have essentially been jumped. Then you need to get them into your country. Then you need to be able to store them. You need to be able to distribute them. And then finally, you need to be able to get them into people's arms. It's the getting them into people's arms this is where the conundrum is. And as I said, it would all be dependent on the communication mechanism that we choose to adopt, and being able to do this in a very slick way that moves along with the time.
Okay, so that's Dr. John Amwese there. He's a senior research fellow with KCCR. He's a public health expert, and he is. All right, John Amwese is back. Doc, make your point there.
Oh, sorry about that. I had a bit of an unstable connection. I was explaining that really getting it into people's arms is the most important part here. And the communication approach is what would allow us to be able to achieve this, given that we have the vaccines in the country, supply mechanism is there, the storage mechanisms are there, the delivery mechanisms are there. It's not just getting people to say, I will take it. And this is why I say the vaccine mandates are perhaps one of the smartest approaches, because then if people want to go to work, they want to go to other places, and they're like, okay, look, if this is what I'm going to do to get there, then I'll just take it. And it's been working in other parts of the world. So I think that's the way to go.
Build herd immunity as we've always wanted to.
Actually, I must have missed your question on herd immunity because of my connection.
What would it take? What would it take for us to have herd immunity as a country, as we've always?
Well, I think Peter already touched on this, which is vaccination is the route. This is the way you want to go. It's actually the quickest, most effective. So it's not just number of people vaccinated, and the reason why we're getting so many vaccinated people also getting the Omicron and all that is because some of us were vaccinated almost a year ago. And so it's like, okay, it's almost back to square one. So if you don't do it quickly enough, then you're just, going around in circles. By the time you vaccinated a couple of millions, those who were vaccinated before are just back to square one and need to be vaccinated again. So you need to be able to push it through very quickly within a certain space of time to get the best bang for the buck.
Dr. Kwashi, are there other ways to build the immunity? Because we're seeing that a lot of people are avoiding the vaccination and it's becoming a problem.
Yeah, I mean, I mentioned this earlier that it's basically two ways, through infection and through vaccination. And you want to go the way of vaccination because, as I'd forgotten to mention, as Dr. Amoisi said, when you have a vaccination campaign, you can vaccinate a huge chunk of your population quickly. And what that does is, even if it might not reduce actual infection, it will reduce transmission, and which by reduce, because you getting infected, you won't be able to grow a lot of the virus, so you won't transmit it as much. And effectively, that limits the number of transmissions in the country, and that also reduces your total disease load. And that means that within that short space of time, you can control your virus. The chance of variants coming up are less, and then the chance of you needing to have more boosters are also less. Now, if you have an extended period of vaccinating using the same vaccines, a few scenarios can happen. One is, as we are seeing, variants come up which might be not covered by your vaccine. And two, you don't suppress that viral load enough to sufficiently prevent onward transmissions. And that's what we are seeing here. Because we didn't cover sufficient amount of the population, we weren't able to suppress the onward transmissions enough. So the vaccination that we are doing in Ghana right now, without it being boosted, we are almost sort of treading water. So that's why it's really important that people understand the need to be vaccinated. And mandates are not new. To travel outside Ghana, you need a yellow fever card, and to go to school in certain parts of the world, you need to be vaccinated against measles, all these things. So these have all happened because of vaccine mandates, and this is how we've been able to develop a much more healthier world now than we used to. So these things are not new. It's unfortunate that when COVID-19 started, anti-vaxxers was a fringe movement, and now it's become a major movement driven by politics. And it's really sad, and it's a very sad development.
And I'm happy that Dr. Kwashi hit on the issue of boosters, because that has also come up. For those of us who are fully vaccinated, will there be the need for us to now think of boosters from the way things are going? Dr. Amoisi.
Thanks, Aisha. I think I already made mention of this, that the boosting is absolutely critical, especially for those who had their full vaccination almost a year ago. Boosting has been shown to be highly effective in raising the antibody level and improving protection and reducing risk of transmission. So definitely boosting is critical. As I mentioned, I get the impression, and I say this with caution, that if one who's already fully vaccinated approaches and wants to receive more vaccine, it will be given to the person. But there is no official communication on this, so please do not quote me. What I'm hoping to hear soon from the Ghana Health Service is some official communication on boosting for those who are already vaccinated and want to receive a booster to be able to do so confidently. Otherwise, we also risk the potential of vaccines being wasted. There was a whole chunk of vaccines wasted last year because they expired, where they had been designated for a particular part of the country, and they could not deliver them to the people. The people refused them. It would have been great if there could have been a quick booster program so that those vaccines could enter arms of people who were already vaccinated and are ready to take it. So we need to have this dual approach. First, to increase the antibody levels at the population level, but also to take care of potential vaccine wastage. I think this dual approach could be very powerful.
Dr. Kwashi, let me ask you this. With just 3% of the people fully vaccinated, what do you think? Government or the Ghana Health Service can go ahead with the mandatory vaccine or the vaccine mandate?
Well, I think that's why they've gone the way of the mandate, and I think that's the way to go, because and that's the way pretty much all countries in the world are going, because you can mandate that public health sector workers are vaccinated, that healthcare workers are vaccinated because they are public facing. You can mandate that entry into public spaces, you have to have vaccination, because again, you are going into a public space where you interact with people other than yourselves. So I think that is the most effective ways. Like I said, mandates are not new, and governments over the years have realized that sometimes this is the only way to do what's best for the country. But I think the low vaccination rates of the population is exactly the reason why the government is going this way. Because early on, there was a trust, I don't want to use the word trust, but an expectation that once we get the vaccines, the public will take it, especially because in the early days, a lot of the outcry was about access to vaccines and whether the government was doing enough to acquire those vaccines. Strangely, once that happened, then the switch is, how can you force people to take the vaccines? You know, so I think these mandates are the way to go. Extending this to students entering universities, for instance. I think UG is, I don't know if it's official yet, but UG is looking at enforcing that for students and residents. And I think this will be the way to actually build that herd exposure, herd immunity through mandates. That's the way that we get from 3% to 30% and beyond.
And finally, let me ask you, Dr. Amoisi, what should we be doing as individuals, as we're told that we're yet to see more of the cases in the coming weeks?
Well, I think it's the same old as we've been saying over the past 1 year, which is to do our best to adhere to the protocols as much as possible. You know, when you go to a place, say there's 5 of you and 4 are wearing the mask and 1 person is not, it's easy for that one person to say, look, you know, let me be like the others and do the right thing. I mean, I was in a small meeting, actually, there were how many of us? 6 of us, 2 days ago. Everyone was in a mask, 1 person was not. And I saw that person actually pick up their mask and wear it. Nobody said anything. That's how powerful it is. When people decide to do the right thing, it perpetuates itself. So right down from the leadership at the government level to really keep on showing this example, keep the reminders on about this. I think places of gathering, workplaces, places of worship, really enforcing the mask wearing and the hand sanitizer use will be very critical. So these are things at the individual level that we can do. And there's one last thing we've not talked much about, which is if you are ill or you feel sick, just stay at home. A lot of people, because the Omicron could be mild, especially people are vaccinated, people are just going about their normal business and sharing the virus because they can move around, and that's not responsible. So at the individual level, one additional thing is if you're unwell, just be responsible and don't move around and spare others the trouble if you can.
I'm grateful for your time. Dr. John Amoisi is a public health expert and he's also a lecturer at KNUST. We also spoke with Dr. Peter Kwashi, who's Senior Research Fellow and Virologist at the West Africa Center for Cell Biology of Infectious Pathogens. I'm grateful that both of you were able to join us. We'll take a break on The Pulse. Remember that you can also tweet at us with the hashtag The Pulse and also join us via all our social media handles on JoyNews on TV. There is more when we return.